Hello guys, welcome back to another video. So today we will be wrapping up cancer, but before we jump right into it, make sure to subscribe, leave a comment, like and share this video. So today we will start off with laryngeal cancer. There are some risk factors that can contribute to laryngeal cancer, and one of the biggest factor is smoking. So tobacco use, alcohol use is another big factor. Some environmental factors may include like pollutants in the air, occupational exposure. Alright, so note in mind, or keep in mind, that the earliest sign of laryngeal cancer is hoarseness. I'm not talking about, you might get up today and you probably have a cold and you were hoarse like half the day and then it clears up. I'm talking about continuous hoarseness. Alright, so what's the earliest sign of laryngeal cancer? Hoarseness. Some other signs to look out for are difficulty swallowing, pain in the neck, swelling of the neck, difficulty breathing, long last cough, or you can also feel a lump in the neck. So these are some other signs to look out for. But what is the earliest sign? Hoarseness. Some nursing diagnoses that can be formed from someone who has laryngeal cancer is potential for respiratory obstruction. Remember, there's a growth in that area, and that goes directly to your airway. So if there is a growth or any type of growth at all, it is a potential to get some form of blockage. So definitely definitely respiratory obstruction. You can have impaired swallowing. As I said again, the area is swollen, so you might have difficulty swallowing. Imbalanced nutrition. If you can't swallow properly, more than likely you won't want anything to eat. Impaired verbal communication, because remember, your voice box is right there also. So there's a swelling, there's something obstructing that area. Also, risk for situational low self-esteem and body disturbance. The neck is an area that is seen by everyone. It's not usually an area of the body that's covered up. So if there's a large mass growing in that area, then you can have some self-esteem issues. So look out for some of these things. So the most important outcome for a patient with laryngeal cancer is maintaining positive oxygenation status. Prevent aspiration. Again, if they have difficulty swallowing, they are at an increased risk for aspiration. Again, if they have difficulty swallowing, they are at an increased risk for aspiration. Promote nutritional balance. Maybe they are gonna need a temporary feeding tube in order to help them get some nutrition in their body. Facilitate alternate communication. So you can introduce like a pen and paper to them. You might can communicate with yes or no questions by the nodding of the head. Stuff like that. So other things that they can use to communicate besides using their voice. Promote positive self-esteem. So get that patient to look at themselves as early as possible. One thing that is most important during the healing process is to make sure that the patient is actually being comfortable or getting comfortable with themselves and their diagnosis. Alright, so there are some non-surgical interventions which may be used to eradicate the cancer, and that includes chemotherapy, radiation therapy. So chemotherapy, we know that it's not going to only kill the good cells. It's not going to only kill the bad cells, but it also kills good cells. So that's more of a general effect on the body. Radiation therapy, that's actually sending radiation beams to the exact area of the cancer or the tumor. So that's more localized. Alright, make sure you make the patient be on vocal rest. Mouth and throat care. Again, if this patient is not eating or not drinking anything, they might have dry mouth. So you want to do oral hygiene as much as possible for that patient. And as usual, you should always do skincare. Remember, if there's a poor nutritional status, there's an increased risk for skin breakdown. So pay attention to the skin. And again, if a patient is on radiation therapy, do not apply any lotions, any emollient to the area where the patient will be getting the radiation. So surgical removal of tumor depends on how large the tumor is. So they will use the gradient T and M to assess the tumor size or the size of the tumor. Alright, so if a patient gets a total laryngectomy, there are some nursing considerations. You have to pay attention to the airway. So make sure that's the most important thing with this patient is to maintain airway clearance. Maintain airway clearance. Make sure the patient has a humidifier. You want to make sure that the air is not too dry for that patient to inhale. Make sure the patient coughs and deep breathes. That's one thing after surgery that a patient should always do: cough and deep breathe, turn and reposition. A laryngectomy stoma and tube may be introduced to that patient, and this will help with breathing and maintaining a positive airway. Also, keep in mind, after a total laryngectomy, you must monitor for hemorrhage. One of the most common signs of hemorrhage in this patient is that the patient is continuously swallowing. Again, the patient is continuously swallowing. If this is occurring, that means there's some form of bleeding going on in the throat, and this patient is just trying to clear that blood from the mouth. So again, continuous swallowing may be a sign of hemorrhage. So we always want to prevent infection, nutritional support, psychological support as usual, and also health teaching. What should they stay away from now? What foods are rich in the nutrients that they will need in order to help to build back their system up? Stay away from the smoking if you are smoke. Occupational exposure, you might have to change occupation. But you have to keep these in mind. Patient teaching is very important also. Alright, so now let's move to breast cancer. So breast cancer is the leading cause of death in women. You may also see breast cancer surprisingly in males, because don't males have breasts too? Yes, so you can see breast cancer in males. So some risk factors include age, estrogen exposure, genetics, family history, diet, exercise. Remember, diet, exercise, whatever you put into your body, it can manifest itself in a disorder. So always maintain a good nutrition. Alright, so now we're going to talk about types of breast cancer. Note in mind, anything that you see ends in situ, that means it's encapsulated or it's staying in one place, it's not moving. Alright, so for example, lobular carcinoma in situ, it's staying right there in the lobes of the breast. So in situ, it's staying there. Another example, ductal carcinoma in situ is only staying in the breast duct, or it's present in the breast duct, and it's usually encapsulated. Right, invasive ductal carcinoma, you know that if it's saying invasive, that means there's a spread going on. Invasive lobular carcinoma, that means there's a spread going on. Other examples are medullary carcinoma, colloid carcinoma, tubular carcinoma. So again, one of the main pointers I have for you guys, if it is ending in situ, more than likely it is encapsulated and it's staying in one place. So, what are some primary levels of prevention with breast cancer? Breast self-examination, clinical breast examination, and mammogram. Alright, so let's talk about self-breast examination first. Alright, so you always want to do your self-breast examination the same time every month, 1 week after your last menstrual period. For clinical breast examination, it's usually done depending on your risk factors. So you would definitely have to, assess the risk factors that patient has. Mammogram is usually done annually, but again, it depends on your risk factors. Maybe your healthcare provider wants to do it twice a year. So usually done annually, but they might step it up to twice a year. Some physical assessment that may be identified to help recognize if you are developing a tumor or if you have breast cancer is, does it have a Bordeaux orange appearance? Is there nipple retraction present? So these are some stuff. Is it movable? Is it localized? Is it all over the breast? So these are some things that you may want to look out for. And the definitive test to know whether or not you have breast cancer is doing a biopsy. A biopsy will reveal if it is malignant or it is a benign, lump going on in the breast. Also, a side note, breast cancer usually begins in the tail of Spence, or is most common in the tail of Spence. And that is if it's your left breast, it's going to be the left upper outer quadrant, so like under your armpit right there. If it's the right, it's going to be your right upper outer quadrant, so right up somewhere up here. Alright, so now it is important for us to differentiate benign conditions from cancerous conditions, because we can scare ourselves for no reason, but with education we know exactly what's going on. Alright, so some indications of benign breast diseases. So multiple or single lumps, rubbery texture, mobile and slippery. So if you can move it around, more than likely it is not cancerous. Regular borders, if you feel it and it's oval all the way around. Tenderness. One good sign if you have breast cancer or not is to see if it's painful or not. So if it's painful, that means it may be a benign this breast disorder, right? No retractions are noted. May increase or decrease in size rapidly. So that's something you still would want to check out, but these are some benign breast diseases that, may cause no harm, but you still want to get it checked out. So for malignancies or for cancers of the breast, you want to look out for unilateral. If it's only in one breast, there's something going on. It's firm in texture and it is fixed, so you're not able to move it around. It might have irregular borders and it is usually painless. You won't experience pain with it. It usually comes with nipple retraction or breast retraction and dimpling, and it grows consistently. Again, it grows consistently, meaning it's not going to decrease in size. You won't notice a decrease in size. Where in the benign breast disorder, you will see an increase and a decrease in size. Alright, some outcomes for a person who is experiencing breast cancer. You definitely want to decrease their anxiety, promote coping, pain relief, self-acceptance. You really want that person to start, looking at themselves once they have a procedure done in order to, feel more comfortable and accept their reality, which is, maybe the removal of either a partial breast removal or a total mastectomy. Alright, so again, for the interventions can vary so much depending on the age of the person, the size of the tumor, the if it has invaded other parts of the body. So again, take a look at what you need to cover for that section. Okay, so one common complication that one may experience if they have a breast removal, especially if they had some lymph nodes removed, is lymphedema. So lymphedema is basically caused from the inability to drain the extra fluid from the lymphatic system. Alright, so in order to help prevent this or decrease the swelling in the arm, you want to place signs above the bed that you should not do any type of procedure on that arm. For example, if you got the left breast removed, you do not want to take a blood pressure. You do not want to insert an IV line in that arm. You do not want to do any injection on that arm. That arm should be free of any procedures. Definitely want to provide support for that arm and make sure you do arm exercises. This means it could be as simple as letting the patient comb their hair. They can do wall climbs, and this will actually promote drainage of the fluid out of the arm. And definitely avoiding injury. You don't want the patient to be doing anything too strenuous, because again, strenuous activity can either cause hemorrhage in that arm or it can even cause further swelling. So you don't want the patient to be lifting up heavy weights, because that's not a good intervention for this patient with lymphedema. So again, you can rest the arm, elevate the arm on a pillow, do your wall climb, comb in the hair in order to help remove the fluid from that arm. Alright, some therapies for breast cancer may include, again, the common ones, radiation and chemotherapy. You may also have monoclonal antibody therapy using Herceptin, which is also a chemotherapy agent. So it varies. Treatment varies from person to person. Again, you have to see the uniqueness of that person in order to see what treatment best work for that patient. So, for psychosocial support, you always want to make sure that that patient is talking. See how the patient is feeling about their current condition. Provide resources for them. Maybe they can join a group, so different resources for the patient, help them to vocalize whatever they're going through, and so you, the nurse, can provide the most optimal care and comfort for that patient. Alright, let's talk about skin cancer real quick. So skin cancer is basically cancer of the skin. So you have different types and different depth of the cancer depending on which layer of the skin the cancer is found in. Very importantly, the worst type of skin cancer you could have is melanoma. Again, the worst type of skin cancer you could have is melanoma. So in order to have a better prognosis, it's always screening, early detection, and early intervention. Alright, so some treatment for the skin cancer. You can either do drug therapy, radiation therapy, cryotherapy, or cold therapy is actually using a very cold substance, for example liquid nitrogen, to apply directly to the cancer in order to freeze it and then remove it. You may also do curettage and electrodissection, basically removal of this cancer directly from the skin, and excision. Alright guys, thank you so much for watching this video. If you have any questions or comments, you can leave it down in the comment section below, and make sure you subscribe to my channel. I will be coming out with more content as fast as possible. And thank you guys for watching again, and all the best and good luck.